Hello, this is the American Medical Association's COVID-19 update. Today we're discussing COVID-19's impact on the LGBTQ community. I'm joined today by Mia Keys, the AMA's Health Equity Policy Director in Washington, D.C. Ms. Keys uses she, her, hers pronouns. Dr. Richard E. Green, Associate Professor at NYU Grossman School of Medicine in New York. Dr. Green uses he, him, his pronouns. Derek Reyes, CEO and co-founder of Queerly Health in New York. Mix Reyes uses they, them, theirs pronouns. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. I use he, him, his pronouns. We know the pandemic amplified existing disparities and inequities in healthcare. Ms. Keys, can you explain how this impacts the LGBTQ community?
Absolutely. So the pandemic makes long-standing barriers to physical as well as mental health care for the LGBTQ community, including access to LGBTQ-friendly and appropriate levels of care, care by culturally competent, anti-discriminatory, and intentionally compassionate physicians and healthcare professionals. The pandemic essentially makes all of that, the disparities related to that, even more profound and insidious in times of public health crisis. And also in terms of cost, both for money and time for LGBTQ persons, particularly for those who are uninsured, this time is especially critical. The community is already three times as likely to be uninsured compared to non-LGBTQ persons. And finally, perhaps most egregiously tied in this moment is the issue of policy. With the enactment of the ACA, the anti-discrimination provisions under Section 1557 prohibited discrimination on the basis of race, color, national orientation, so on and so forth, including sexual identity and sexual orientation and gender identity. But these provisions are now essentially under fire as the current administration is threatening to roll back those protected status. And so it's completely unconscionable. It erodes the civil rights practices and progress of our nation. And we're going to really see a lot of people suffer if we don't protect LGBTQ persons in terms of policy.
Absolutely. And as Ms. Keys said, access to care is such a huge issue during this time. One of the things that this pandemic has really brought out in our patients is we're asking most people to stay home, right? And so even younger, healthier people who are part of the LGBTQ community who don't have access to outpatient care don't know who to call and figure out, do I go into an emergency room or don't I, right? What are my health concerns? What are my health considerations if I don't have someone I can access to get personalized individual care because I'm afraid to be stigmatized or because I'm afraid to be spoken to in ways that are uncomfortable for me or that make me feel denigrated, then I'm not going to show up for care. And I'm more likely to show up in the emergency department. I'm more likely to contact other people who have COVID when maybe I don't need to.
Dr. Green, Mix Reyes, why is this community especially vulnerable to complications from COVID-19 and other health issues?
So there are a few different issues, I think. Many of them are driven by minority stress, which we know impacts all minority groups, but LGBTQ folks are much more likely to smoke, much more likely to use drugs, much more likely to suffer from depression or anxiety. And so social isolation can make all of that worse. We know that we don't know enough about the impact of HIV or cancer and COVID. And so while people with HIV might not be more likely to get COVID, long-term complications of having HIV might make people more susceptible to some of the complications of COVID. And so we need to know more. And in the absence of that data, just trying to keep people as healthy as possible is going to be our biggest challenge. And that means getting people to contact healthcare providers.
And the trend is too that LGBTQ plus folks are far more likely to delay seeking out or visiting health and wellness centers and often just completely avoid them. And now we're at a time where we're being asked to avoid going out at all. And the preliminary first step for folks when seeking out care is to contact a healthcare setting. So it's especially concerning because folks just don't know how to navigate or have had a really bad experience navigating the healthcare system in this country. And we're also, the reality is that not every LGBTQ plus person is staying at home right now with supportive families or with a support network that affirms their experience. So I think a lot about what this does to our mental health as a community, especially for people who've been their gender affirming surgeries have been put off, or like consultations for gender affirming hormone therapy. So it's definitely, COVID-19 is definitely something that looks like it's set to widen existing LGBTQ plus health disparities.
And to Dr. Green's earlier point, we don't yet know the rates of COVID-19 as it refers to the LGBTQ community, and which is troubling given the risk factors he mentioned in terms of tobacco use, poverty, homelessness, but then also violence, and especially violence against transgender persons. That just makes members of this community especially fearful, and to Ms. Reyes' point, maybe even fearful for presenting for care. And so when we're looking at policies in response to the pandemic, the members of the LGBTQ plus community are left out of the national conversation, and also left out of the data collection, right? And so without the data that are specific to gender identity, that are specific to sexual orientation, we risk another crisis of marginalization, similar to that which happened in the 80s and even existing to this day with respect to the HIV crisis. And so, that is particularly disconcerting.
Dr. Green, Ms. Reyes brought up the topic of mental health. When you look at societal issues and directives like social distancing, how do these play a role in both the physical and mental well-being of the LGBTQ community?
Thank you for asking. I think it's a really important topic for us to talk about. I think social distancing is, as a doctor, I understand a really important protection against contracting COVID. But it's also really important for us to remember that people who are already depressed or anxious may have worsening of those symptoms, that people who have waited sometimes years for gender affirming surgery, who have been on wait lists for years, and suddenly to have them canceled can worsen people's mental states. We know that there's a significantly higher risk of suicide among LGBTQ folks. And so all of these things can exacerbate or worsen the kinds of experiences that people are having. And we know from the 80s and from HIV, as Ms. Reyes pointed out, or Ms. Keys, sorry, pointed out, that stigma only worsens that. And so when people start to look at people who are starting to break social isolation because they need contact with people in person, we start to judge that, we start to stigmatize people, and people also might not seek care for those reasons. And so maybe at home and suffering.
Ms. Reyes, these are significant challenges. What can we do to relieve them?
Sure. So I think one of the best things we can do right now that we've taken on the responsibility of doing at Curly Health is identifying those practitioners that aren't just LGBTQ plus affirming, but also informed. A lot of practitioners, will be perfectly fine treating LGBTQ plus people, but aren't necessarily trained on LGBTQ plus health and wellness. So what we're doing is setting a bar, a baseline competency of LGBTQ plus health and wellness when we vet our practitioners. And in identifying those practitioners, we're making sure that we're doing the legwork for LGBTQ plus people to no longer avoid health and wellness settings. And one of the things we're working on as well is telemedicine. Like, one of the reasons why we even started this benefit corporation is because we saw that the digital health space was just going to gloss over the LGBTQ plus community like traditional healthcare seemed to do. And we just weren't cool with that.
What can you talk a little bit more about that? What does it mean when you talk about kind of glossing over it? What other things do you need to take into account?
Sure. So for us, for example, we've LGBTQ plus healthcare, a lot of it has been siloed to major metropolitan areas in the country, right? And often in nonprofit clinics. They're often at capacity or strapped for cash, and they're not always completely accessible to the LGBTQ plus community. Like, even me, with everything that I know here in New York City, which is a bastion of LGBTQ plus healthcare, I've been turned away from LGBTQ plus clinics before because they're at capacity. So digital health has this really great capacity to unburden physical healthcare systems because you can see more patients in less time. And you can also see patients remotely for about 85% of visits anyways, non-emergency visits. So when we started Queerly Health, there weren't any apps or websites or anything that really took into consideration the LGBTQ plus community or even listing providers that were or practitioners, I should say, that were LGBTQ plus affirming. A lot of times for us, even when we do have really good health insurance, and access to practitioners, it's been really difficult to locate and find those practitioners. So we just avoid it altogether.
Ms. Keys, can you talk a little bit about the AMA's resources for LGBTQ population?
For sure. So I will first and foremost, I want to lay out three different things in terms of policy, in terms of allyship, and then also in terms of being of support to LGBTQ physicians as well as patients. So in terms of policy, the AMA has longstanding and extensive policy on LGBTQ plus related health. And so I would most certainly encourage our membership body to be in touch with our advocacy office to learn more about those policies. You can go on our website and learn more. The Center for Health Equity also maintains a COVID-19 specific resource page, where on that page we list out to extensive protocols and practices, best practices in the field. And I believe, if I'm not mistaken, Ms. Reyes, we referenced some of the things from Queerly Health, and if not, then we will absolutely go back and make sure that it's up there because we appreciate and follow you all's work. The other thing in terms of allyship, to Ms. Reyes' point, it's not enough for physicians themselves to be LGBTQ affirming. It's also important that they're also culturally and structurally trained and competent in the particular needs of patients who are presenting with unique challenges as a result of their gender orientation or sexual orientation, or gender status and sexual orientation. And then finally, I think it's really important for persons, whether physicians or other healthcare providers and professionals, to really take on ownership of allyship, right? And especially for persons who are working in public health and private settings and also in policy settings. So for myself, whenever I orient myself with respect to LGBTQ related health, as an ally, it's very important that I speak on behalf of all persons who historically have been stigmatized and marginalized and medically underserved. So do keep in touch about our policy. Please be in touch about the CHE resource page and make sure, irrespective of sexual orientation or gender status, that we're all coming to the table with openness of mind and compassion of heart.
Well, thank you, Ms. Keys. And you can find those resources on health equity at the AMA COVID-19 resource area at ama-assn.org/COVID-19. I want to thank our guests today, Ms. Keys, Dr. Green, and Ms. Reyes, for being here today and sharing their perspectives. We'll be back with another AMA COVID-19 update tomorrow. Thanks for being with us here today. Take care.